Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Hey. Well, I am so excited to host our dear friend and senior executive in the healthcare industry, George Hickman. Most of you that have worked with him over the many years he's been in the industry call him Buddy. So Buddy is a 5-time health systems CIO and a former Big Four consulting partner with extensive experience in transformational leadership, digital health, data analytics, digital health governance, cybersecurity, and served 9 years on CHIME's bootcamp faculty, which we're actually going to in November. So hopefully we'll see you there. And in addition to being a public speaker and well-published, he's currently a sitting member of CHIME's board of directors, is both past board chair for CHIME and HIMSS, past chair for CHIME's foundation, its education foundation, HIMSS Executive Comp Committee, and HIMSS Analytics. So Buddy sits on other healthcare industry boards and advisory committees and is amongst those named as Health Industry CIO of the Year, which makes me extremely proud to have you. I know this is a mouthful, but one last thing is you currently serve as Chief Strategy Officer for First Health Advisory, which is a managed services, security, and assurance firm. So I want to hear all about this, Buddy. But first, welcome to the show.
Leah, thank you. It's a pleasure to be here. Special thanks to you, but also to my friend Michael Blumenthal, your Chief Revenue Officer, both of you for inviting me to share some thoughts with you and our listeners.
So when I introduced you, that was quite a mouthful. And I do want to know, before we dive into our topics around digital health, can you tell me about a day in the life of Buddy Hickman? What are you doing nowadays? I know every day is different, but give us a sense.
Most mornings I get up and have 3 or 4 cups of coffee just to get me in the right place, right? And as I said to Carter Groom, our CEO, this morning on our regular Monday 9 a.m. call, I had 8 different things open trying to process them all at the same time, which is just the way it works for everybody, I think. As Chief Strategy Officer, I've worked with Carter in writing our strategic plan, which is, something that should be in constant redraft. That includes guiding principles and all kinds of other directional things. Even a revisit of our mission and vision statements. Often I find myself sitting in front of our customers, our clients, on any manner of discussion. As a cybersecurity risk managed services firm, that's usually prominent or front and center. Yet at the same time, if I'm finding myself in front of the chief digital officer or CIO, frankly, I'm often the translator to that individual as to my colleagues, given the years I sat in that role and bringing that around, into bringing our topics around to relevance to the CIO and the rest of the C-suite. I could find myself traveling at any given moment to either a client setting or to many of the conference venues. In fact, Jessica and I were last week, we're at the HIMSS Cybersecurity Forum in Boston. I'll be at the CHIME A Group meeting at the end of the month, and of course, wouldn't miss Fall Forum. So that's just another way of connecting, should we say. And for the most part, if I really sum up what I do, that's it, connecting. I spend a lot of time talking to people, sharing ideas back and forth, constantly learning from my friends and then sharing that back. Also making lots of introductions by and between folks that sit in the provider C-suite so that they have the advantage of what one another knows.
So you're really in the nucleus of everything. You're in the nucleus between people and trends and everything going on in the digital healthcare ecosystem. Before we dive into your predictions about the future, what is one thing you're seeing now or one trend that's really standing out in the ecosystem today?
Well, I found myself in numerous conversations last week and reading a bit this weekend on what is occurring with adoption and use of AI, that big hyped term in the healthcare provider space and otherwise. It seems to me that if we can keep ourselves grounded in certain fundamentals about how we make decisions and govern our digital health decisions accordingly, that AI will be viewed as one more tech that will find its way to the mainstream. But otherwise, you know me, Liette, I worry. I was reading a McKinsey report that called out some of the activity that's occurring right now with AI from their most recent survey. And in the paper I read around generative AI, my biggest takeaway was that organizations are recognizing AI risks. Okay. And I'm talking about all kinds of categories of risk: inaccuracies, cybersecurity, IP infringement, compliance and regulation, and privacy, to name the top several. Yet those that are taking action about those risks are lesser than those that recognize that the lists exist. And that's almost categorically down the list of concerns. Obviously, whatever's new and shiny, we have to take responsibility in how we decide and use.
Let's talk about digital health, Buddy. What are some predictions about technologies that will significantly reshape healthcare in the next 5 to 10 years?
I have to take a deep breath to answer that question. That's one of those, let's dive in the deep end. All right. I'm gonna offer a few ideas, all right, that things that maybe we already have on watch, but just to call them out one more time. There are all forms of AI. We talk about machine learning or generative machine learning, natural language processing, pattern recognition, and frankly, the composite AI tech, meaning bringing all those elements together and representing that in various use cases, and the extensions even to ChatGPT-4, and so on. I'm expecting that we'll see breakthroughs, like real breakthroughs of imaging modality products, whereby in the next 5 years, the modality itself will do the read of an image as a doctor does today. It will provide a predictive diagnosis or maybe several diagnoses based on what it sees with likelihood. Now, if you remember Jeopardy and Watson Health a few years back, that demonstration was made on Jeopardy with that kind of result for whatever the questions were. The early Watson effort, in my view, is that it had high need for data consumption and all kinds of integrations, which at the time were trying to be accommodated with HL7 and other historic frameworks for data movement. The FHIR standards were not far enough along with APIs and so on, and you couldn't scale Watson. So maybe that's what the Watson renewal is about, because we're now watching that shape in the media. But right now, I'm speaking more about the modalities themselves delivering the capabilities versus something outside of those modalities, like Watson, so that the algorithms actually exist within those modalities. Applications could be for reading images for diagnostic radiology or radiography, CT scans, ultrasounds, MRIs for any kind of clinical cause: orthopedic, skin, cancer cell, cardiac, neuro, prenatal, maternal care, and other disease concerns or wellness concerns or abnormalities. The diagnosis will be enabled by the physician's role, because overreading will be something that we will need to assure safe diagnosis and capabilities of those technologies. And I think that we could expect that at times we might find that the tech gives more diagnoses than the doctor might have thought to see. However, also, on the other hand, I've got some emergency medicine physicians who insist that there's nothing like a clinical physical interrogation where you have this gestalt that happens with the patient that causes that physician to intuit some things or remember that one little thing out here from med school that gets pulled in that comes to the forefront maybe in ways that might not happen from just the ingestion of an EHR and all the related data, right? Or images. I guess I would end that thought with, I believe our largest scale, the HR vendors, are already reaching that way as well. and we'll be looking at bringing full integration of both what's in the EHR along with the imaging capabilities together, curating all of that, synthesizing it then again through the clinical notes and all kinds of algorithms to make even greater suggestions. We know Epic, Meditech, and others are well on that path. And what's going to be interesting is to see how the best of breed use cases stand up and how long they stand up in the ecosystem of the EHR, watching how the prominent EHR vendors are moving that forward. I guess another thought, maybe around ChatGPT 4. It's likewise amongst the most heaviest of the hype technologies in the media. For it to be effective in healthcare, the HDO, the Health Delivery Organization, should consider business and clinical use cases that will scale to better and safer quality and patient-safe care outcomes, as well as looking for the other efficiencies. I guess where I'm tending on this is whatever the case, there should be a business case. The business case should focus on value under a number of different ways of measuring and repetitive use for the sake of yielding a true value proposition. I am still at heart an industrial and systems engineer. So, being able to have a predictable and standardized result from very well designed queries with those technologies so that you remove variation will always allow for a better outcome. Then you can begin to focus on improving cycle times beyond that. And I believe the debate on safety will and should continue. It has to until we start seeing things evolve. So I've mentioned AI. I've mentioned ChatGPT 4. I've mentioned AI with cybersecurity now with a reference in your first question. I know that data analytics and predictive analytics will continue to be heart and center, and also may or may not use AI algorithms as part of how you do that. But it's all about the evil math, and the evil math is necessary if we're going to advance. 5G, other advanced connectivity forms, means of managing quantum computing. You notice how blockchain isn't being talked about as much right now. A year ago, we've been talking about that. It still has its place in the ecosystem. And then metaverse and all that's happening there, too, must be paid respect to. There's a lot going on. That person that calls himself the digital executive has their hands full. The key is, how do you pull down the ones that make sense for the HCO that you're a part of?
And so you named a spectrum of tools that are available out there. I feel for the digital healthcare execs that have to be reading, I think, every morning, and absorbing information to know what's up to date today. With so many tools available, though, Buddy, how can healthcare delivery organizations discern whether a certain technology is right for its needs? What should one consider before they adopt a new tool? What's your advice on that?
Well, I think the first thing a health delivery organization must consider, in light of whatever it's wanting to position and market, is its means or its ability to resource. We can't be all things to all people. There are those HCOs that have much deeper pockets than others. But I think the vast majority these days struggle with the bottom line and are figuring out how to make wise choices. For me, that carries us back to this notion of shared leadership governance, being principles based, managing a balanced portfolio, one that considers both risk and return. My analogy for a digital health portfolio or an IT portfolio has also always been to compare that to how you manage your personal wealth. Depending on where you're at in life cycle, what your means are, you may have the ability to take more risk in your portfolio, or you may not. And I think the risk profile of most HCOs is somewhat averse. We have to understand that high tech, high-end tech, advanced tech is risky because much of it's not going to make it, or it's not going to work the way you thought. And so you have to manage an appropriate proportion of that into your portfolio while you bank on the things that will the spend will give you the return and the predictability that you hoped it would be. And I think that's key. Otherwise, you're going to, fall prey to this thing we call tech bloat and, and not deliver and suboptimize value.
So when you mentioned shared governance, give us a little more around that. What do you mean by shared governance? How does that work exactly?
Once upon a time, I would have talked about shared governance in the context of IT. And as we have evolved, I now frame shared governance in the sense of saying you have to have a way of bringing all your transformational initiatives together with IT, with the label that we use digital health, because some people may parse that away from IT, with cybersecurity, with biomedical and clinical engineering, and anything of the tech realm, frankly, because in the end, it's all about, people, process, technology, data. So when I talk about governance now, I sweep that broadly because whether or not you have all that happening within one governance structure, you have to hinge the decision-making bodies together to cause it to be one governance that's based on principle. Real shared governance creates role clarity. It creates systems thinking around business and clinical ownership. It assures these custodial elements like compliance, cyber, and risk management. It is principles based. Usually the principles are organizational value statements, statements that you can expect the leaders to use as I had one CEO say, the flags we salute when we're making a decision and the filters that we put things through before we move forward. Whether it's a new idea or a legacy sporting idea, all these things can go into structured business cases. And the collective leader should learn how to make decisions around, I'll call them short form business cases, to say those get to advance and it's okay to say no or not now on the others. Some of that stuff's about keeping the trains running and some stuff is really about transformation, but it all still needs to walk the same process. It needs to have an adherence of a group of people that are making decisions together. And all of that, of course, relies upon a healthy culture and a healthy leadership team that will cause it to adhere.
And so that causes me to ask you, as you've experienced CIOs and some pain points that may have repeated themselves in your conversations with these healthcare execs, what is a major pain point you're seeing today in the role, and how do you advise folks to tackle this?
I'm still seeing disconnects that I could say existed historically, but maybe we're seeing them evolve again. The circumstance, maybe the items that we're speaking of have changed, but the problem itself of communication as human beings back and forth and being able to find our way to the middle is still a function of who we are, right? Back to your reaction to the Gestalt statement, the idea of a machine making decisions for us. Some might say it'd be a lot easier without having to deal with all the people. Yet it is the people that have to come together to make for the greater play. I'm convicted on that. So to your question of pain points, I have seen a few CIOs find themselves feeling very challenged, trying really hard to do the right thing in terms of leading the organization to understand the complexities of all of the things that have to come together to make a plan and make something that is deliverable. And yet many not understanding that and wanting to reach out and implement the shiny object or the executive bling that will get the attention of others or maybe the news splash because of the relationship that just got brokered with, one of the disruptors. Well, it all still has to come together if you want to see it through to execution. That's the bottom line. And a few CIOs are saying it's just gotten too hard. And so, as you and I have talked about offline, some of them have said, I think I can go do something else that would make it easier. I hope that we don't see that as an outflux and that this is just another one of those growing pain blips that when, digital health and all the nuances that come with it have been introduced uh, rapidly into healthcare provider organizations, that we can find our footing here within the next year or so and really feel solid about the kinds of decisions that are making. Collaboration will help that, honestly. So,
Very true. And actually, let's build off on that before we move on to the next topic. You and I did speak offline about the movement of CIOs kind of leaving the healthcare provider sector. So, what are you seeing there? What are you hearing from friends and peers and colleagues?
there are a few that I've talked to directly that just said it's got to be easier. Um, I'm hopeful that we don't see an exodus. We've had that conversation even amongst the CHIME leadership team, and keeping it on watch and trying to keep fingers to the pulse of how the CIO and chief digital officer crowd are navigating. I could put the CISOs in the same group. I mean, the work of the chief information security officer clearly has moved significantly in profile in the last 3 years amongst healthcare provider organizations. Both of those are roles to keep an eye on, given the amount of rapid turnover that can happen as a result of things getting off balance.
Yep, it'll be interesting to see what happens in the next 5 to 10 years with these advancements and the rapidly changing ecosystem. So we have yet to see. Buddy, I'm going to take you now to Washington, actually, sharp turn to Washington and the continuing concerns of cybersecurity threats, especially in healthcare. So I know you and your firm are active in tracking the work in DC, and you're also even advocating for change. Can you share more with us, whatever you can, with inside scoop?
Well, that one's a big nugget too. I would say, first of all, I have an old friend once told me, gosh, it's been almost 20 years ago, a state hospital associational federal advocacy leader said, as to matters on the Hill, be careful what you ask for, you might get them. And she was right. At the time, we were advocating for EHR adoption and had been told by certain legislators, if you don't do it as an industry, we're going to do it to you. And it eventually did happen through the advocacy and the decisions of the legislation in Washington that we found ourselves sitting on the meaningful use program. It provided a lot of funding and it did act as a stimulus, but a lot of the result also are things that some were not happy about at all in terms of, literally the clinical workflows and such that evolved with some of the EHR vendors. I could say the same thing now about cybersecurity concerns. There are some that believe that voluntary frameworks should be enough. There are others that don't believe that voluntary frameworks are nearly enough. Some are greatly concerned about investment monies, especially for healthcare providers who happen to be in rural settings, small organizations, possibly, but rural settings otherwise, because they're removed. And if you think about a disruption in operation as a result of a cyber event, a rural setting organization has greater vulnerability to its community and its ability to move patients to another setting should that need occur. So there's special attention being given to those groups as well. I'm definitely a supporter of what I'm seeing going on the Hill. Carter Groom, our CEO, is active with the healthcare and health public sector, I should say, Cybersecurity Coordinating Council, led by Greg Garcia and a number of other experts. Work around HHS Section 405D cybersecurity standards. All of that's a framework, a voluntary framework. Should we have it? That's about a maturity scale. There's been a renewal of work around the healthcare cybersecurity industry practices, which is really about calling out the key threats, where the threats are called out based on those that are most likely to happen with the highest impact to healthcare providers. So that, those are the things to button up. Senators Warner and Cassidy have both been active in fostering legislation come forward with other senators around them, other House members around them. And in fact, I think Senator Cassidy just last week issued a request for information set of statements that any of us could be responding to, saying, here are the things based on those questions that we believe should change about privacy and cybersecurity in the healthcare provider sector. Even more of the stacking up here. And then finally, I'll offer, the NIST cybersecurity framework, which many of us look to as a standard, still remains a voluntary framework for healthcare providers on the whole, although it may not be if you happen to be publicly traded or associated to the federal government. That framework is going to introduce another competency area, should things happen the way we hope it does, in its its new draft. It's out there in float right now. The competency being around governance. We just talked about governance, but now imagine measuring as part of your cybersecurity capabilities and competencies, do you have good governance intact here at the board, fiduciary level, and as management? And having that report carded and available not only for your board's review, some cases community review, or even your cybersecurity insurance carrier's review. I mean, the stakes keep increasing is what I'm suggesting here. I'm hopeful we get our game on with this. The threat is remarkable. I heard John Rigi from the AHA, former cybersecurity agent for the FBI, speak just last week. John's message is loud and clear. The third nation state threat actors are serious about what they want to do. We have to get incredibly serious about the positions that we're taking right now if we're to protect this nation's assets, which include our health and our health care.
You've mentioned many serious matters that are being discussed right now in Washington. And what is one that you would hope to report back when you're back with me here in a year that has been really signed off, that has been cleared, clarified to all?
In the cybersecurity space, I would like to see clarity as a nation of those standards that we need to be adhering to as a health and public health sector, a minimum baseline, along with perhaps additional maturity baselines, clearly understand if there's going to be any incentive or otherwise funding. I say an incentive or otherwise, because it may not be in the form of incentive. It may be that it could be on the basis of need. Okay. But we need clarity around that to help move this time forward for those that can't afford it. And that, unfortunately, it happens to be a lot of organizations in the health industry based on the kinds of margins we're looking at. So having that clarity of what, if there's going to be funding to support it, and the fact that we have a timeline then that we need to meet it with based on maturity, I would hope we have something in place. Yes.
Okay, well, fingers crossed for that. We've reached my favorite part of these episodes, which is let's get personal. I can't help but ask you for some of your personal advice with your accolades and experience and expertise in the field. So my two last questions. One is, you've been involved with CHIME and HIMSS and their respective leadership roles for decades. Could you share a bit of those experiences and how you believe you shaped those organizations and will continue to shape them, I assume?
Well, I'll start off by saying I was very fortunate at the beginning in that I had an undergrad advisor who took me very seriously when I said during my junior and then senior year, as an engineer of all things, that I wanted to work in healthcare. I really wanted to work in healthcare. I had a mission mind for it, and I felt like it was a place I should be. He handed me off to a former advisee who had graduated a few years ahead of me out of the same program, a guy named Roger Henry, who's with HCA Health Trust now. And Roger took me under his wing as sort of, his mentee. And while he helped me position to get my first healthcare job, he also said, hey, there's this organization I want to introduce you to. I've been a member of it, and it's like going to keep growing. It's called HIMSS. And so I joined HIMSS right out of college as I took a role in a hospital organization. If you do it long enough and spend enough time at it, you can become a fellow, you can become a life member if you want to do that. I tended to volunteer with the state organizations, regional organizations first, and then had one of my friends nudge me, again, another mentor, somebody that I was close to as a sitting CIO when I was in my first CIO job. And he said, I really think it's time for you to run for the HIMSS board. He was coming off the chair role at the time. And lo and behold, eventually I found myself on the HIMSS board and then eventually serving in the chair and a whole bunch of other committee work and all that, as you heard. Well, similarly, John Glasser, who at the time was a CIO at Brigham Women's, gave me a call and said, hey, we're thinking about uh, creating this thing called Chime. It's going to be a spinoff for CIOs with HIMSS. We're probably going to do some things with HIMSS and so on. And I listened to John, wanted to learn from John and a whole lot of folks who were out there in front of me, and so I engaged and I jumped into Chime. Uh, well, yeah, looking back, I never thought at the time I'd find myself similarly down the road, having someone nudge me and say, "Why don't you run for the Chime board?" Board work, and then eventually find myself as board chair. In the end, I can't attribute all of all the good that's happened to me to myself. I certainly have worked hard to try to do the right things, but I've had a host of people around me who have wanted to help. And I think they understood a lesson early in life, which is all about helping the people around you find their voice. And I was fortunate. I had people who wanted to help me find my voice. Some of the work that we've done along the way had to do with, when I was with HIMSS, writing the first HIMSS international plan with Ivo Nelson and Steve Lieber, standing up the first HIMSS executive comp committee, which was important at the time because we didn't know within months that we would get the question of, do you have a comp committee, given all the IRS audits that were beginning to happen with not-for-profits? Buying a company that we turned into HIMSS Analytics, buying into a media company because we knew we needed revenue diversity because one annual conference go bad, the whole organization would have flopped. And Chime was similar. My ride at Chime, there are things about Chime a lot of people don't understand, but that includes that Chime originally was an outsourced organization managed by another group, and the entire management team functioned out of that. So it was during, I guess, my chair-elect year with Drex DeFord as the chair, and then following in my chair role, that he and I, together with a host of people, because it always takes a lot of people, did the onboarding of Chime, hired Russ as the CEO, and really helped the organization get its footing to create now a very different Chime organization moving forward. Appreciating everything that Rich Burrell and that team did along the way. And I'm naming names, but the names are countless. I'll just say that, all the people that contributed. I mean, who had ever known that when I was chair, that I would have to deal with that, the onboarding and all the things that brought and the legal work, et cetera. But who would have ever thought that John Kravitz, followed by Tanya Townsend, would have had to manage Chime through a pandemic, right? So when you sign
No
up,
one would have known.
you don't know. You just don't know. So
Yep.
all of this is about, for me, everything I've said is about a whole bunch of people that love these two associations and are willing to give back, have found their voice in many ways, but have probably figured out how to help others find theirs. And you probably know I'm quoting Stephen Covey in The Eighth Habit right now, but in case you didn't, I had to call it out.
Lots of shout outs today. And we love Russ as well. He's doing a wonderful job, I think, today. To leave us off, Buddy, for a last piece of advice, speaking of finding your voice, enabling others to find their voices, what would you offer? You walk into a room of 100 new chief digital and information officers just entering the health sector today with the hopes to lead the
Frightening.
future. What's that?
Frightening.
Right? You crawl in, you
Yeah.
don't even know where to start. But no, they really do want to lead the future of healthcare, technology enablement, all that good stuff. What is one last piece of advice you'd like to leave our listeners off with, new
Mhm.
or already, years in the field?
Well, so it's almost a CHIME CIO boot camp answer, Leah, right? The healthcare provider sector is amongst the most complex business models of any industry sector. Peter Drucker once said, any existing organization, whether a business, a church, a labor union, I don't know what all he said, but he said, or a hospital, it goes down fast if it can't innovate. Then he said, conversely, any new organization, whether it's a business, a church, a labor or a union, or a hospital, it will collapse if it doesn't manage. He's also the person who said that hospitals are the most complex form of human organization we've ever attempted to lead and manage. So, I always, I've said it before, see what we do as the delivery of this fine design of people, process, technology, and data. CIOs, digital health leaders, those that choose this path and do well at it, have that innate sense and view, even though it's a learned and grown discipline, truly is. But when you combine it with those who think about the work in the health sector as personally significant, and they want to do it because it is about a mission of healing, wellness, and giving a gift of life. As I've said to folks in boot camp, you're called to this work. You have to give yourself to the calling. When you give yourself to it and it's calling, that will help you fight through your moments of frustration, because you'll remember all of those moments of hope, even joy, that will help you transform yourself when that's the issue at hand. And that's going to help you transform your organization and the people you serve. That's what will lead the sector to the next paradigm. This whole change, it's reliant upon technology, but it's really reliant upon you.
I couldn't agree more that the people are the force, and tech and everything surrounding us is just tools to get us, you know, reaching our goals quicker, faster, more efficiently. But at the end of the day, I definitely rings true everything that you're saying. And I do want to thank you on a personal level as well for being on the forefront of this intricate front line and doing such meaningful work and leading the future leaders. So thank you so much, Buddy, for your time. We can't wait to see you in the fall at all the upcoming events. And Hyro loves you as well as a dear friend. So on all fronts, thank you so much for your time.
Lynn, it's always a pleasure. Thanks for spending time with us this morning.
Thank you for listening to Patient Journey Pioneers, brought to you by HIRO. Subscribe to our podcast on your favorite listening platform. See you on our next episode.